So rhinoplasty is a very popular procedure done by facial plastic surgeons. There's really two goals for rhinoplasty. One is to get patients breathing better if you have trouble breathing because you have something like nasal obstruction from something in your nose. And the second is facial aesthetics. So the vast majority of patients that I see have some combination of both, but really it's to create a nose that really suits you, is true to you, and completely preserves authenticity. So we're not making noses look like a different person or like a celebrity. Really, we want to create a nose that fits your face and that you're happy with. So when you come in for a consultation, we'll take a look at your nose, I'll look at the inside, and then we'll do what we call morphs, where I'll take your picture that you had that you came in with, and then we'll change the nose to see if you like it. Now, that's a process so that you can be comfortable with what I can achieve, and then I can tell what's reasonable to give you a realistic expectation. But rhinoplasty is one of the hardest procedures done in all of cosmetic surgery, which is why it's important to trust your face to a facial plastic surgeon. So rhinoplasty is about a 4 to 6 hour procedure. It sounds like a lot in the surgical world, but really it's not that much because a lot of the moves that we make in the surgical procedure are small micromillimeter movements that are very impactful. So if I'm doing a surgery and I throw a stitch that I'm not comfortable with, we take it out and I do it again. And that's important because the perfect time to get your nose set to where you want it to be is during the surgical procedure. The downtime for rhinoplasties is about a week to 2 weeks, and it's really just a social downtime. So after your surgery, you'll have a cast on your nose, some stitches and splints inside your nose so that you can breathe. All of that comes out at about 5 to 7 days. And after that, you can breathe pretty well. But you'll still have bruising in and around your eyes and around your nose that can last up to 2 weeks and maybe a little bit longer. Most patients are fine to go back to work in about a week, but the vast majority of patients feel fine as soon as everything is taken out of their nose. Common misconception about rhinoplasty is that it's going to change the way you look, but really it's all about creating a nose that fits the rest of your face, that can look either more feminine or masculine depending on what you're looking for, and also just allow you to breathe a little bit better. The goal of the surgery is to do a procedure where most people are not going to know you had anything done, but they'll notice that you look a little more refreshed or just a little bit better in general, and they might attribute it to something like a new haircut. So an important thing about rhinoplasty is it takes a full year to see your final result. So while you'll look really nice after your surgery is done within the coming weeks, you'll have a lot of swelling, and that can take about 3 months to settle and 1 full year to see your final results. So I always tell my patients there are some days that you're going to love your nose and other days you're not because maybe you had too much salt to eat or you slept on your face a little funny, but in the end it's about a year to see the final result.